Okay, my name is Larry Collins, and this is my presentation on posture in elderly women, or more specifically, flex posture in elderly women, uh, pertaining to good posture and what it can do for you. Okay. All right. So, what is good posture? Good posture is achieved when a person holds themselves in a position which puts the least amount of stress on their spine and neck. It is important for proper muscular usage and increases the efficiency of the muscle, leading to less muscle fatigue and less muscle pain. Okay. Uh, it also leads to good muscle flexibility, which in return improves mobility, muscle coordination, and reduces risk of injury. And I got the information from physioworks.com. Okay. Then uh, bad posture can lead to flex posture or kyphosis. And as you could see in the example down below, in the picture down below, there the guy on the left, he is an example of good posture, and the guy on the right, he is an example of kyphosis of that Mark string flex posture. Okay. All right. So, for the intro to the article, um, within the study, I looked at the researchers looked at elderly women with flex posture to compare the severity of their flex posture, of their skeletal fragility, and their functional status level. Okay. The researchers found an article stating that when the postural alignment is a little off, there may be a way to correct the alignment, but when derangement of postural alignment is severe, then compensatory measures may no longer be effective, and disability may occur. Um, for the methods, they had 88 subjects in total, but they had to exclude 28 of them. Uh, so, it, so the total in the end calculation would be 60. Then they had all the patients be female, uh, between the ages of 70 and 93. Um, and all the women were referred to the geriatric department for back pain, and all have flex posture. Alright. And for their tests, the women were asked to stand with their ankles and backs touching the wall, and to measure how much their head protruded, as you could see in the picture. That's what they had to basically perform, and if their head was 5 centimeters or lower out, then it would be considered mild flex posture. 5.1 to 8 centimeters would be considered moderate, and more severe would be 8 centimeters or greater. Um, they used radiographs on on the lumbar spine and right proximal femur to get their average measurements and T scores. The manual they used manual muscle testing to estimate the strength of the spine extenders, uh, abdominal muscles, and abductors, and also more muscles. There was a bunch. Um, they used the short physical performance battery as a balance test, a speed test, and a chair standing test. And then they also measured disability through a self-report. Okay. Okay. And in the results, they found that the severity of the amount of people with the severity of flex posture at mild was 11. The amount of people with moderate flex posture was 28, and the amount of people with severe flex posture were 21. There were no significant differences observed between the three severities for skeletal fragility, but there was a significantly there was a significantly lower muscular strength and severe flex posture groups compared to the mild flex posture groups for spine extenders, ankle joint dorsi, and plantar flexors. Okay. The the pectoralis major muscles and hip flexor muscle groups were significantly shorter than the severe flex posture groups, and the severe flex posture groups than the mild flex posture groups. Okay. All right. So for motor function, the severe flex posture patients had a slightly but statistic but statistically significant significantly lower scores than mild flex posture patients for balance and gait scales. And for the disability, it was only slightly, but still significantly worse for severe flex posture groups compared to mild flex posture groups. Okay. Okay. So in the end, then the researchers found that there was a weak association between the severity of flex posture and disability. Gait and balance were only slightly reduced for those with flex posture. The severity group, the severe group, basically scored higher in depression when they had to do their self-report. And one of the things which I said that they could do in the future is that they could look at both men and women with fixed posture, with flex posture, and they could also look at more severe cases of flex posture, to where to where the patient is essentially bedridden, to actually just look more into the injuries that are associated with flex posture. Okay, and then they also found that cervical and lumbar pain was more severe in moderate and severe flex posture groups. Okay. Okay. So the spine extender muscle strength was found to be lower in severe flex posture patients, and osteoporosis it is not caused is not the cause of flex position in women, but flex position may actually play a role in the formation of osteoporosis. Okay. So what they concluded is that the severity of a flex position is based on the severity of pain, the emotional status, the extent of muscle impairments, and the level of motor function limitation provided to the person. The flex position had a limited effect on disability. As I said, it was a slight significance. Flex position, back pain, and mobility problems can occur without osteoporosis. So yeah, so if a person has flex position later in life, they do not need osteoporosis for it to actually occur. The results show rehabilitative programs should consider not only strengthening spine extender muscles, but also consider joint flexibility, balance, and gait performance as well as emotional status. And this could also be used for athletes because they basically need flexibility whenever performing sports and whatnot, and to make sure that they have the correct posture whenever they play, or else can they can get injured, or such as how it says inside here, just every day, day to day, it could lead to flex posture. All right. These results were useful in planning physical exercises and programs aimed at preventing or correcting flex posture, especially in older women. And as you can see inside the picture on the right, then there is an example of paired posture compared to correct posture, so that way you could make sure that you practice the correct posture. Okay. So, true or false, osteoporosis is caused by flex posture. Okay. So, what do you think? 5, 4, 3, 2, 1. The answer is false. Flex posture can occur with or without osteoporosis. Okay? And then for the next question, it is flex posture can be prevented by practicing good posture. Can it? Find out. 5, 4, 3, 2, 1. And the answer is true. Practicing good posture can help prevent flex posture in older age, amongst other health benefits. Okay, and then these are my references. That's it.